Have you ever been embarrassed about a certain health condition you've been suffering with for a very long time? Well, you're not alone. But before we delve into the discussion, please remember to like, subscribe, and hit that notification bell to stay updated on our future videos. Health conditions are as common as the air we breathe, yet many people feel shame or embarrassment about them. Today, we'll discuss 9 conditions that are nothing to be embarrassed about. It's time to break the silence and start a conversation to understand better and manage these conditions. So sit back, relax, and be prepared as we're about to delve into our list of common health conditions you shouldn't be embarrassed about. Get this. The first hot topic on our list is pesky skin conditions such as acne, psoriasis, and eczema. Now, don't be fooled. These are not the result of poor hygiene or bad habits. Nope. They're often the mystery result of genetic factors, immune system responses, or environmental triggers. Take acne, for instance. It's usually the sneaky outcome of hormonal changes, while psoriasis and eczema often play hide-and-seek with an overactive immune system. The signs. These conditions can range from mild inconvenience to severe disruptions. From red alerts, redness that is, to inflammation huddles or even flaky skin, they've got it all covered. But here's the golden nugget. These conditions are not contagious. You can't catch acne, psoriasis, or eczema from someone else, so breathe easy, the silver lining. These conditions are expected to be as common as possible and can be corralled appropriately. This could mean pulling out the big guns, topical creams, oral medication, or strategic dietary changes. Remember, the end game here is to remember these conditions don't make you any less of a superstar. They're just a tiny part of the unique you. Keep this in mind, your skin doesn't define your worth, it's just the cover to your fabulous story. Next up, we have mental health disorders like depression and anxiety. These are more common than you might think, with millions around the globe experiencing them at some point in their lives. These disorders can significantly impact daily life, affecting everything from your mood and energy levels to your ability to perform routine tasks. It's essential to understand that having a mental health disorder is not a sign of weakness or something to be ashamed of. It takes great courage to acknowledge these issues and seek help. Many resources are available, from counseling and therapy to medication and support groups. Remember, it's perfectly okay to talk about mental health. Opening up about what you're going through can be a decisive step towards recovery. It can also help to break down the stigma associated with these disorders. So don't be silent, don't be embarrassed. Your mental health matters, and seeking help is okay. Coming in third, we have digestive disorders such as irritable bowel syndrome, IBS, and Crohn's disease. IBS is characterized by a group of symptoms, including abdominal pain and changes in the pattern of bowel movements. These symptoms can cause discomfort and distress, often impacting daily life. On the other hand, Crohn's disease is an inflammatory bowel disease. It causes digestive tract inflammation, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. While these conditions may cause inconvenience and discomfort, it's essential to realize that they are much more common than you might think. Millions worldwide live with these conditions, navigating their daily lives around their unique health needs. So, if you're battling a digestive disorder, remember, you're not alone. It's not something to be embarrassed about. It's just another aspect of the human condition. Remember, everyone has their unique health struggles. Moving on, we have sexual health issues like erectile dysfunction, ED, and polycystic ovary syndrome, PCOS. Erectile dysfunction, commonly known as ED, is a condition where a man finds it difficult to maintain an erection during sexual activity. Various factors, including stress, certain medical conditions, or medications, can cause it. On the other hand, PCOS is a hormonal disorder common among women of reproductive age. Women may suffer from irregular menstrual periods, excess hair growth, acne, and obesity. The good news is that both of these conditions are treatable. ED can be managed with lifestyle changes, medication, or even counseling. PCOS likewise can be controlled with lifestyle modifications, hormonal therapy, and sometimes surgery. The key to handling these conditions is open dialogue. Don't shy away from discussing these issues with your healthcare provider. Remember, there's no shame in seeking help for any health condition. Your sexual health is essential, and it's okay to talk about it. Next, we touch on a sensitive subject, incontinence. This is a condition where one lacks voluntary control over urination or defecation. Various factors such as aging, injury, or certain medical conditions may cause it. It's important to know that incontinence is a common issue, particularly among older adults. Treatments are available ranging from lifestyle changes to medical procedures. There's no need to feel embarrassed or isolated. Remember, it's okay to talk about it and seek help. Lastly, we have bad breath and body odor. These conditions, often seen as embarrassing, are pretty common. Bad breath could be due to many reasons, such as poor oral hygiene, certain foods, or even some medical conditions. Similarly, body odor is typically a result of bacteria breaking down sweat. Fear not, both can be managed effectively with good hygiene routines and occasionally medical intervention. So don't let these issues weigh you down. Remember, we're all human, and these issues are a part of life.